Premier Smith spoke at a town hall, and apparently the world's going to end.
Apparently it is. I think I saw Naheed Nenshi crying in the street as I drove to work today. It didn't come as a surprise. I think Danielle Smith campaigned on she was going to shake up AHS. She was going to change it. And she talked at a town hall this week about basically getting AHS out of the hospital business and getting private operators or existing operators like Covenant Health to take it over. And of course, the left predictably lost their minds, and the end of the world is nigh. But you've talked about this ad nauseum. Every healthcare system in Canada is provincially broken. We get scads and scads of dough, and the productivity is not improving at all. It's getting worse. Whereas you look around the world and other countries do things differently, and things change. But any mention of privatized healthcare in this country and people lose their mind.
Well, let's just fact check on that quickly. Before we get to, I saw Naheed Nenshi's NDP leader's statement, and he said outright on his X posting, Danielle Smith is going to privatize hospitals. Let's call it out right now. That's absolute a lie, and it's BS. But it shows desperation on the part of Alberta's NDP. I mean, whatever Smith may be doing, it may be a good idea, it may be a bad idea, but she's not privatizing hospitals. Is this where the discourse is going to go from here on in, though, Nigel?
Well, I probably will. I mean, we've seen lots of political campaigns where one side tries to tar the other side unfairly and inaccurately. I actually kind of wish she was trying to privatize the hospitals. That would suit me a lot better. But what I think she's trying to do is change the incentives at every level. I mean, this is what you would have, what you could have with a different way of administering hospitals. Let's say that the money followed the patient instead of a hospital saying, well, there's 1 million people, so you get a per capita grant times 1 million. When it's like that, every patient is a cost. I don't really want to see you. On the other hand, if the money followed the patient, and if you went to this hospital is the one that got paid. But if you went to that hospital, that would be the hospital. Which hospital do you think is going? They're both going to be. Good Lord, they'd have the hospital administrator out the back calling in cabs to get people into their own emergency room. I'm being flippant, but the incentives matter. And so the incentives in the existing Alberta health services have produced a large, fat bureaucracy which gets fed no matter what happens on the ground floor. And if you put this out to bid, a slimmer administration will probably have a good chance of producing a better result for less money. Now, they will have their problems. They will have the problems that you were talking about in your column with unions that are obviously going to try and protect their own turf. It's great when you can get an hour's wages for taking a 15-minute phone call at home, the kind of things that the contracts allow. They're going to have to fight with that. Well, okay, we'll see what they do with it. But the idea of changing the incentives in order to save money, absolutely valid.
Absolutely. I thought Corey raised a very good point in his show earlier today about the hypocrisy of the left. When you look at the facility the Enoch Nation is building near Edmonton, 3,000 operations a year, I think you said. They were orthopedic surgeries a year. It's basically a privatized hospital, but because it's on Indigenous ground, the left doesn't say a thing. But if it was planned for downtown Calgary, there'd be masses of, they'd be protesting the building.
Well, this idea has been around for quite a long time. It was actually putting hospitals on the reserves. Yeah. And it's interesting that it happened first in Edmonton. I always thought that it would be down here at the Satina Reserve, They've been very entrepreneurial. Anyway, maybe there's one in the works.
Yeah,
who knows? But it's when this province has got a number of private hospitals on reserves if necessary, and you can say we have these procedures to do, let's have your bids. you will find that the competition will bring down the price. And more important to the people who need the operations is it'll be quicker. They are going to build the capacity to meet the demand. And I dream, if I dream at all about healthcare, and praise God, I've never had to experience it. But if I dreamt about healthcare, I would dream about having a constellation of hospitals in Alberta to which people were coming from all over the country, even from overseas. Medical tourism is a real thing in some countries. It could be in Alberta, but we have that stupid Bill 11 that Ralph Klein, the worst thing that Ralph Klein did back in 2002, that makes it actually illegal to put a private hospital in Alberta. The only workaround is what we're talking about, was where you go on the reserve and you put the building there.
Yep.
Nobody can say a thing.